when our kids are having behavior issues, we go internal, we isolate it, we try and hide it, we try and ignore it because it's really freaking tough on us because we think the problem is us. And I've been in practice for 16 years, moms and dads, and I can tell you the vast majority of the time, the problem is the perfect storm. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. All right, mom and dad, imagine this. You have had a long, crazy, stressful day. You had all the work stuff, you had all the life stuff, you had all the pickups and the drop-offs and the school and the homework, and you name it, you did it that day, and you're dead tired. But you're also excited because you're going to sit down to a family meal and you're all going to be together and you're just going to be able to recap your day until there is a 5-star, full-throttle, absolute meltdown from one of your kiddos because you chose the wrong color cup or the noodles are not their favorite kind. They are spaghetti noodles versus penne noodles versus whatever it may be. To trigger that tantrum, trigger that meltdown, trigger that absolute behavior issue, it probably happens more often than just that dinner. And it's absolutely exhausting. And if it happens in public, out at a restaurant having dinner there, and it happens in front of other people, behavior issues in kids are not only exhausting for us as parents, they're embarrassing. And that's just being real right out of the gates with this podcast episode. The truth is, it's so hard to be a parent, period. Even when our kids aren't overstressed and when their nervous systems aren't all wound up, which I'll teach you the science and neurology of actually what's really causing behavior issues. But actually, before we do that, we'll actually answer some of your toughest, biggest questions when it comes to your child's tantrums and meltdowns and behavior challenges. First off is it normal or is it not? Are they just a toddler? Are they just a little boy? Are they just going through puberty? Are they just exhausted? Is this normal or is this a sign of something deeper going on? Is there some dysfunction, some imbalance, some dysregulation within their nervous system? So first, parents with this episode will help you answer those questions. Second, if that is the case, if there is something going on, what the heck is it? Is it really just like medicine would say with ADHD and behavior issues? When I say medicine, I mean traditional, conventional pediatrician. Is it, don't worry about it, they'll just grow out of it? And then when they don't, you go back to the same doctor and they go, I think they have ADHD. Here's some class 2 narcotic stimulants. And you say, well, what caused it? It's genetic and an imbalance in neurotransmitters, in these little chemicals. And that's a good theory if you sell chemicals for that condition instead of actually getting to the root cause of it. So I'm going to spend actually very little time on the whole ADHD, behavior issues are just genetics. There's nothing you can do about them. It's a chemical imbalance. Your kid needs to take prescription chemicals for the rest of their life. I'm not going to spend a lot of time on that in this episode because I bet if you are here listening to me, you're already looking past that. Maybe you've already addressed or considered that option. Maybe you've already taken that option and it didn't work. And not only did it not work to help your child's symptoms of behavior issues, maybe you dealt with a whole host of side effects like stomach issues, cardiac issues, sleep issues, weight gain issues. So I'd imagine for 99 out of 100 parents out there listening, you are already done with that one, or you chose to be done or save it for a last resort. And what you'd like to hear on this episode is the actual root cause science behind behavior issues. Once we figure out, is it real or is it not? Okay, it's real. I'm dealing with this every single day. Not only is dinner time tough, not only is homework tough, not only is not, getting them to just stop fighting with their sibling for 1 second of one day tough. Not only are transitions tough, try going asleep, falling asleep, staying in bed, getting your child to make good decisions with their food instead of eating just Kraft mac and cheese and sugar and soda all the time. I could go on. That's just a list of, 5 to 10 different signs or symptoms of behavior issues in kids. The truth is, for most families, they're dealing with these all day, every day. And that's where the overwhelm, and that's where the exhaustion, and of course, really too, That's where a lot of times the embarrassment can happen, because often our kids get most overwhelmed in public places, in school, doing homework and trying to keep up with life in that way. So it makes sense. And a lot of times, even when it doesn't at all align with parents to take medications, they will follow suit with that path for their kiddos. But most parents today have moved on from medications. They're well aware that this isn't something that is just purely genetic and a chemical imbalance. There has to be something going on, and there is. And we're going to cover that today. But I bet you've already done quite a bit of homework. I bet your journey to figure out your child's behavior issues in this natural, holistic world has maybe led you down a conversation about the gut-brain connection, the microbiome, and diet, and detoxes, and inflammation. What I find when I talk to a lot of parents today who are looking for natural, drug-free help and solutions for their kids with behavior issues, ADHD, ODD, those sort of things, they've already gone to great lengths to get sugar, get gluten, get dairy, get chemicals, get red dye number 40 out of the way. And pretty much every parent I talk to who's gone deep down these natural holistic roads is super stoked and super grateful they have, because their child is better. You better believe you don't want to fight fire with this one, which is always it's a bit of a tricky science that stimulant medications are supposed to help calm overstimulated kids. Well, when it comes to diet and nutrition and natural health, many families report, heck yes, if I can get my kiddo to not have sugar, not have gluten, not have chemicals, and not have these things every single day, they're better. So when we remove them or lessen them, we have less behavior issues. When I can get my kiddo to sleep, when I can get my kiddo to take those deep breaths and work on maybe deep breathing techniques or meditation, relaxation, or let's go to our role in this, parents, when we're trying to figure out reward charts versus discipline versus how we navigate this ourselves. When you can keep your nervous system de-stressed and calm, and you can speak to your child in the middle of a meltdown in a calm, empowering, yet firm way, let's just go back through that list. Because right now you're all like, oh yeah, that stuff. That's the stuff I read on those Facebook groups. That's the stuff I read when I did my Google searches, which, by the way, we empower and love that you do. So keep doing them. I'm not going down that road like a PD. Oh, yeah, Dr. Google. Yeah, Dr. Google's brilliant. Go ahead and keep using him. All right. So what I'm getting at with this, though, is your real life of behavior issues and the frustration and the exhaustion that comes from them doesn't just end at the symptoms. It continues down the road of you trying to help. You know what a raging bull, wound up, hyperactive, impulsive kid wants to eat all day, every single day? Sugar. You know what they don't want to eat? Broccoli, protein, and healthy omega-3 fatty acids, and they certainly don't want to take all those supplements and all those essential oils. What is a child who is absolutely wound up and can't calm down their brain and nervous system? Because as I'm about to teach you once we get into the meat of this episode, their nervous system is imbalanced. There is actually something going on under the hood with kiddos whose nervous systems are really, really overstressed and stuck on what's called sympathetic dominant. So that kiddo does not make good decisions when it comes to transitions. That kiddo does not make good decisions when it comes to a sibling or a friend or someone else taking something from them they didn't want them to. That child can't make good diet and nutrition decisions when their brain is running on hyperspeed on default. That child can't take a deep breath when their physical body is so locked into fight or flight sympathetic tone that their diaphragm, their breath, and even the muscles of their neck and their traps and their spine are so wound up and physically tight that a deep breath and good healthy foods is actually uncomfortable to them. It's not just difficult, it is uncomfortable. That's why they have to move. That's why they have to talk. That's why they have to stem. That's why they have to challenge and push the boundaries. And that is also why they cannot fall asleep. So we're already mixing the real life challenges you're living with the real, actual, updated, modern understanding of the science behind behavior issues. And here's what it is: stress. Now, we think of that word for us because we're living this life as parents with work, with school, with our kids, with everything else. And if your kiddo's having daily or frequent behavior issues, now you've got stress on top of stress. So we look at that and go, man, we can't be healthy. our emotions, our focus, our decision-making, our emotional and behavioral regulation. I know we don't think of it as behavior as adults, but do we always behave very well with our emotions, with our relationships, with each other, with our spouse, with our kids, with work? When we're stressed out, we don't. When we're wound up and worn out. So we're actually going to talk about behavior issues are a mix of a child's nervous system being stuck on stress mode. It is too wound up, too sympathetic dominant, too fight or flight. And when that happens too often, but especially early during a child's brain and nervous system development, we're going to go back into what's called fetal development and the connection between stress from pregnancy and labor and delivery and early infancy can trigger, and often does, and nobody looks back that far, which is why they don't find the real root cause answers to it. But stress on the nervous system shows up more often for our kids in what are called sensitive, critical periods of brain development. And the behavior issues may not be called that or shown that until they're 2 or 3, or maybe even in school, because that's when behavior is supposed to develop. But what if the brain and the nervous system has had altered, imbalanced, dysregulated, dysfunctional development? Well, then that child is stuck on stress mode. They're wired, they're wound up. But also what happens with behavior issues is they're tired. Because just like us, moms and dads, when your child is stuck on fight or flight 24/7, 365, and they can't sleep and they can't calm and they can't regulate their behavior, that is also exhausting to them. And even kiddos who do not have behavior issues, ADHD, anxiety, and so forth, when they are tired, when the classic example I use all the time for parents with this one is when your toddler skips their nap, and let's just say optimally developing, beautiful, wonderful toddler who listens and sleeps and eats all their vegetables and is nice to everyone else. So let's actually play this toddler scenario out with a wonderfully, optimally developing toddler. When they skip a nap on vacation, how are they at dinner, at the restaurant, or at the resort that night? They melt down. They have tantrums. So we all know that a tired child is one who's going to have more behavior issues. And that's the golden thread of this episode. I want you to know that the real root cause of behavior issues is, first, an overstressed, stuck on sympathetic fight or flight nervous system, brain, spinal cord, nervous system. We're going to get real nerdy here for 5 to 10 minutes. And then we'll close this episode with not only how do you know that, oh my goodness, that sounds like my kid, that is my kid. How do I find that and how do I help them with that? That's the last 5 to 10 minutes of this episode. But they're also tired because a child who was born into a stressful environment, born through what we call the perfect storm, and I'll teach you next, they get so wound up so early and are stuck there so often, eventually their nervous system runs out of gas and they're exhausted. And so if you have a grade schooler, a middle schooler, a high schooler, or a teenager whose behavior issues are at the worst ever, it's probably because their nervous system is now not only overstressed and off track developmentally, or imbalanced, as we say, and dysregulated, but that has probably now added up to exhaustion as well. So let me get you into what triggers that stress on the nervous system. Let me get you a little bit more science into exactly what that is and what it does to the brain and nervous system and how it kicks out behavior issues from this inside overstressed nervous system. And then again, we'll close this one down with how do you find it? How do you help your child without drugs? Real quick, before I get exactly into this 3-pronged neuroscience I want to teach you with this episode, let's go back to the question that I know you all have. Is this really an issue? Is this really behavior issues? Is it maybe ADHD? Is it a diagnosable sort of behavior issue and altered developmental state for my child? That's the big question. We got to get an answer to that question before we really need to know the science that might cause that disorder or cause those challenges. And that right there is why parents find so little answers in the pediatrician, the neurologist, the psychiatrist's office, because there isn't a test for ADHD. Because when they blame genetics and neurotransmitters, wouldn't it be nice if there was an actual test to prove their theory and say, pretty much like they do with every other condition or every other set of symptoms under the sun, shouldn't they be able to say, there it is, that's the root chemical cause of ADHD? If it's supposedly an imbalance of things like dopamine and serotonin, where's the test? and then show me exactly the amount of imbalance so then I can handle it exactly with the medication. And they don't do that. They throw darts. The theory behind the chemical imbalance and genetic theory of behavior issues and ADHD is as outdated as it gets. But there is predisposition. Our kids do tend to be wired the way we're wired. So what if you're like me, mom and dad, listening to this episode? What if you are ADHD? And I know you can't see me finger quote that right now. What if you are a highly wound raging bull? What if your life is super wound up and you're tired and you're cranky and you're exhausted all the time? Is that genetic if our kiddos are picking that up from us, or is that environmental? Now, I actually am not getting into this thread for this minute or two to say, oh, it's on you. But it's not on you. It's not just genetic. It's not just bad luck. It's not just your DNA and your family tree. And that is also still true even if you do absolutely have ADHD, even if you do absolutely struggle with keeping your nervous system calm, keeping your brain focused and regulated, keeping your emotions and behavior regulated. I am abso-freaking-positively ADHD raging bull myself. Scroll up a little bit when you get done with this one and listen to my deep dive episode all about ADHD, and you'll hear my full personal story where I struggled with it for 20 years before I found neurologically focused chiropractic care, which got my brake pedal to match my gas pedal. Now, I love that I'm a raging bull. I love that God gave me quote unquote ADHD because I get more done by 10 a.m. than most people do in 10 years. But the truth is, I couldn't do that if I didn't know I went through the triggers that I'm about to show you. And that right here is the first way you figure out if your child likely is really dealing with behavior issues. And it's not something that's normal, and it's not something that they're going to grow out of, but it's something that is actually coming from a root cause neurophysiological imbalance. The first way you figure that out is you look back in your child's case history and you ask yourself if they had any of these things I'm about to rip through, which we call the perfect storm. Number one, we know that brain development. So the brain is obviously going to regulate our decisions, our behavior, and emotions later on in life for our kiddo. So if it gets thrown off track because of these early triggers, these early perfect storm, just elements from development forward, there will be problems. It's just called something different in medicine. So if your pregnancy was a high stress, highly wound fight or flight pregnancy, we now know it is clinically proven. We know the neuroscience behind it. I won't get that deep in this episode. And we also know through what's called meta-analysis studies. So they look back and they mathematically connect these dots. A high stress, high risk pregnancy is strongly clinically correlated with ADHD, behavior issues, anxiety, defiance, those sort of things in kids later on. So high stress pregnancy, if that was in your child's case history, then it could very well be a sign that their challenges are definitely for real and definitely something you're going to want to address with the drug-free care options we go through at the end of this one. The second element of the perfect storm is birth intervention, birth trauma. Now, I'm going to go through this for 2 minutes right here on this episode, but if your child had forceps, vacuum, induction, C-section, scheduled or emergency, breech, cord-wrapped presentation, heart accelerations and decelerations on the fetal heart rate monitoring, if they had a tough, stressful start, that means there was physical injury to their neck and to their brainstem. Now, I know we're on a podcast, so you can't see me act this out with my hands, but the truth is grabbing a hold of our babies who cannot physically protect and move their own head and neck. That's why for many weeks and months after the baby comes out on this earth side, when you hand them to someone else, you say, hold the neck, hold the neck. We all just know that the neck is the on-off switch. I know how simple that sounds, but Iowa farmer teaching neuroscience of behavior issues right here. But the neck in the brainstem area is the on-off switch to stress, and stress is underpinning behavior issues. In the brainstem is what's called our primal brain. That is where our fight or flight versus our brake pedal, relaxation, regulation side of the nervous system is. And when a child is born, high stress pregnancy, but then especially high intervention, that is better termed birth trauma. And that physically, chemically, emotionally often traumatic birth triggers an immediate sympathetic response in that child. Now, what we call that in an infant is colic, difficulty nursing, torticollis, plagiocephaly. We now know also there is a high neuroscience. We can map it all the way out. And I have a whole episode about birth trauma as well. So if this one, you're like, son of a gun, what if that's it? What if that is what's causing and triggering my child's behavior issues even 7 years later? Finish this episode and then go listen to the birth trauma episode. It will blow your mind all the way when I explain the neuroscience behind this physical, emotional, and often chemical birth intervention, triggering a sympathetic fight or flight storm that shifts the child's nervous system into that locked in fight or flight stuck nervous system. For an infant, that's called colic and fussiness. They don't sleep well. They don't soothe well. They don't calm down well. Isn't that ADHD? Isn't that a behavior issue? Isn't that a tantrum in a 2-year-old? Isn't that a meltdown in a 3-year-old? Isn't that an inability to sit still in a preschooler or a kindergartner? Isn't that a absolute 5-star meltdown and tantrum in an older child as well? The neurology doesn't change. Medicine just gives it a different diagnosis so they can dismiss it as normal when they're an infant. Then they label it as ADHD or diagnose it supposedly as a real neurological problem later on, and then they medicate it. And still, all along that path, they haven't done anything to help you figure out, is it real? And if so, what's really actually causing it? So I'll finish it with this. Once that birth trauma, those perfect storm elements happen, and the third component of the perfect storm is early exposure to medications. If your child was put on antibiotics, corticosteroids, those sort of things within the first 1, 2, 3 years of life, that then wreaks havoc on the gut. That wreaks havoc on the gut-brain connection. That gets in the way of their ability to absorb serotonin, dopamine, and so forth. So there is absolutely a connection to toxins or chemicals and the gut and the brain and behavior issues. So I mentioned this in the beginning in the introduction. If you've already cleaned up the diet, if you've already detoxed and you've already worked on your child's gut, trying to get to their brain and get better behavior out of their nervous system, you're a boss, you're a rock star, and you're barking up the right tree. But that is the third trigger of the perfect storm of behavior issues. And the first two need to be addressed differently because the first two cause a couple of nerdy terms we're going to rip through. Number one, dysautonomia. We've been talking about that the whole time. The nervous system gets stuck in fight or flight, and therefore it can't shift onto the brake pedal. So when your child can't calm down and listen, it's because internally their nervous system is literally neurologically stuck on fight or flight. The term for that in the nerd world I live is called dysautonomia. Another term that spins off of dysautonomia is what's called dyskinesis. Dyskinesis is a term for abnormal energy output. That can look physical. Often kids do get physical. When they're having a tantrum, they'll be violent, they'll hit others, they'll hit themselves if these behavior issues get bad enough. That is a huge expression of this dyskinetic or wound up state. If the brain and the body are stuck and full of stress on the inside, the only way the child tries to dispel that stress is to express it on the outside. They're not trying to get in trouble. They're not trying to have a tantrum. They do not want to not fall asleep either. Trust me, as a kiddo who spent 20 years before I got adjusted, before I got my nervous system regulated, I couldn't sleep. I couldn't sit still. I couldn't pay attention. I got pissed off really easily. And that made me more stressed. I wasn't trying. I was just naturally, neurologically shifted and stuck in that way. So what's the answer? What's the solution? Well, we have to take this imbalanced, dysregulated nervous system and we need to get it back into balance. We need to get it back into regulation. You actually can see the answer in your child day to day. When they are super wound up and super ticked off, they move, they stim, they may touch things, they may bite things. Your sensory child may chew on things all the time. And you, in order to get your child to calm down, you might have to physically give them a big hug, a big squeeze. To get them to sleep, they might need to wear a weighted blanket. See, sensory processing issues are at the root of behavior issues, and they are also the thing we're going to use to get to the natural, drug-free options to help get your child out of this nonstop, everyday behavior storm. Because there's a little thing called proprioception. Proprioception is the last nerd word of this episode, and it means the perception of movement. And a child or a person, us, who are stuck on fight or flight, we feel better, we get calmer, we make better decisions when we move. And so that's what a child is doing. And that is why movement-based science gives us the answer as to why behavior issues are there in the first place and what we can do about them. Because the way the brain is wired is the back of the brain regulates movement. The brainstem and the cerebellum are the primal brain. So when this thing called dysautonomia, subluxation, that's another word for that, sympathetic dominance and imbalanced nervous system, when that sets up shop from birth trauma, in the neck, in the brainstem, from those things, it leaves the nervous system locked into bad decisions. Because what the brainstem does, what the cerebellum does, is it sends this sympathetic fight or flight surge from the back of the brain to the middle and the front of the brain. The middle of the brain has things like the amygdala and the hippocampus. The hippocampus is good. That can calm us down. The amygdala, that is big emotions. That is big tantrums and meltdowns when it's overstimulated all the time. And then this message from your child's body to their brain needs to be calm, needs to be clear, needs to be balanced, and it needs to be regulated as it comes from the body, this proprioception, this stimulation of movement, up through the spinal cord. This is where chiropractic enters the picture, to the brainstem, to the back of the brain, through the middle of the brain, and to the front of the brain, to what's called the prefrontal cortex. Now, where medicine and those that are actually looking at behavior issues as a brain-based problem are looking for the answers to behavior issues, which is another way of saying bad decision-making, they look for it in the prefrontal cortex. Because we know that if we can get the prefrontal cortex activated, stimulated, and functioning appropriately, then people make better decisions. Then kids better calm their behavior, their emotions. The prefrontal cortex is the boss for sure, but the boss is getting bad information in behavior issues. What we now know, and we'll close it down with this, when a child goes through the perfect storm, when they have this physical misalignment, tension, movement-based disorder, movement-based problem, that's called subluxation. That's called dysautonomia or nervous system dysfunction, especially when it sets up shop in what's called the neurospinal system from birth trauma, from childhood falls, from looking and staring down at a screen too often. Those are just a few of the causes of subluxation and sympathetic dominance that would make it a case for your child to get checked and get their nervous system balanced and regulated by a nervous system focused chiropractor. So what I went through those in detail now, but what I want you to do is go, not only do I figure out if my child is having real, actual behavior issues by the severity and the frequency of their symptoms. That's how medicine kind of does it. They send you a survey and you say, how bad is it? And how often are they occurring? And if it masks out that it's pretty bad, quite bad, and occurs all the time, then they call it a behavior issue. But they still don't test for what's actually going on within the brain, within the brainstem, within the spinal cord, within the sensory nervous system, like we're talking about today. So first, yes, you can start to figure out if your child's really struggling with behavior issues by the severity and by the frequency of those issues. Second, though, this is where I really wanted to help you with this episode. You can go back into your child's case history, and if they had 1, 2, 3, or more of those perfect storm factors, if pregnancy or fertility even was stressful, if labor and delivery was physically traumatic, and don't overthink it. Even little bits are lots of bits to the very sensitive nervous system in those moments. And if your child was colicky, fussy, chronic ear infections, constipation, eczema, didn't sleep well, didn't latch well, didn't nurse well, got sick quite often as a little one, they don't grow out of that. They grow into tantrums. They grow into meltdowns. They grow into difficulty with sensory transitions as a 2-year-old, 3-year-old. And so often for so many families, that ends up with a diagnosis that starts with the letter of A later on when grade school happens. But the answer isn't just in their genetics. It's definitely not there. Their answer isn't just in chemistry. We can't just blame neurotransmitters, and we also just can't blame gluten, red dye number 40, and the gut. We've got to look deeper into this birth trauma, into subluxation, into dysautonomia, and that will leave you with looking deeper, looking further into neurologically focused chiropractic care. Here's what's really stinking awesome. We can find this, and we do. Not only do you know, hey, if my child went through some of these perfect storm things, that is a much greater likelihood of their nervous system being subluxated, being dysregulated, being out of balance. But you can find the final proof of that by getting yourself into the office with your child who you suspect has some behavior issues, and maybe now, after listening to this, is stuck in fight or flight. Their nervous system and their brainstem is imbalanced. And if you now know by listening to this, and moms and dads, you're freaking brilliant. And the most accurate thing I've ever seen, I don't know if they'll ever be able to research this, and I give no craps if they can or not, but the most accurate thing I've seen in 16 years of taking care of kids is moms and dads know. You know better than me and all my neuroscience. You know better than medicine and all their testing. You know if your child is having real issues, and especially now that we went through the perfect storm, you know that's the trigger. There it is. Now really find out. Get yourself into the office of a nervous system focused chiropractor. PX docs all use the technology that I'm going to verbally illustrate here at the end. We can test for this. There's a set of scans that are called neurological insight scans that tell us, show us, and quantify and locate exactly how bad, how much of that sympathetic storm is your child dealing with, and they help us target and navigate our adjustments and our techniques that are safe, that are gentle, that are easy, and absolutely, positively, of course, are drug-free. And those adjustments are designed to get in and get that stress off the sympathetic nervous system, to release and calm down that fight or flight system. And the way we actually do it is we activate the brakes. We stimulate what's called the parasympathetic system, the vagus nerve, which I can't believe I didn't even mention to this point, which is the number one rest and digest nerve. I've got a whole deep dive podcast episode all about birth trauma, all about ADHD, all about the vagus nerve. So if this episode about behavior issues caught your eye, caught your click, and I guess technically caught your ears because you're listening to this because you're wondering, or you know for damn sure your child has behavior issues, go into those other episodes and dive deep into those as well. Go to our website, pxdocs.com, and read the articles about ADHD, about sympathetic dominance, about dysautonomia, perfect storm, subluxation, and then go to the directory, find yourself a nervous system focused chiropractor, and find out for sure if your child's nervous system is overstressed and stuck on fight or flight. The scans we run in our office literally take 15 to 30 minutes max. They are all sensory. They are all so easy. We make it fun. We make it engaging. We make it easy for the child. You will be blown away when you see these scans. You will finally, with your own eyes, be able to see, and the doc will sit down and explain and interpret everything to you. You'll be able to see, there it is. That's the meltdowns at the movie theater. That's the tantrums at Target, at preschool drop-off. That's why my child can't fall asleep. That's why I can't get them to stop fighting with their sister. That's why I can't get them to make better decisions with the foods that they eat or don't eat. The answer to behavior issues lie within an overstressed, stuck on fight or flight nervous system. And the way you find out for sure, without guessing, but what we like to say, we don't guess, we test. You get into a PX Docs office, you get these exams. We'll put more information about the science. We'll put more information about the technology and the insight scans in the link in the show notes. My last request is, if this was helpful to you, please share it. Please send it to another mom, to another dad. I know sometimes, again, we talked about it in the beginning, like we know other kids, other families are having these challenges. Maybe you've talked about it with them. If so, obviously even a little easier to share something like this. But man, a lot of times when our parents are, when our kids are having behavior issues, we go internal, we isolate it, we try and hide it, we try and ignore it because it's really freaking tough on us because we think the problem is us. And I've been in practice for 16 years, moms and dads, and I can tell you the vast majority of the time, the problem is the perfect storm. The problem is their nervous system got overstressed, stuck on fight or flight way early. It's been there since they were a baby, and we can get that taken care of. It's not on you. It's now that you need a different kind of doctor who will actually listen, actually care enough to address the root cause and give you drug-free options you've been searching for all along. And since we know other parents probably all over the place are out there looking for that as well, please share this episode. And if you're loving the Experience Miracles podcast, please leave us a review. If you're listening on Apple or Spotify or wherever it is, will you please leave a review? Because that helps us find more moms, more dads, and be able to put more hope, more answers, more nerdy, yet hopefully really, really simple scientific explanations and drug-free action steps and solutions out to this world that needs it so bad right now. Thanks for tuning in. See you on the next one.